And she's doing something close to my heart, comparing, I suppose, acne scarring treatment with dermal microneedling and CO2. We were doing microneedling back in 1996 in Australia, believe it or not, but the rollers came out much later than that, and I'd be interested to see this myself. You're very welcome.
So thank you very much for the kind introduction. I know that I got complained a lot with my last name, but totally you can blame it on my husband. So this topic is totally different. Totally different from Dr. Marini because he's talking about all the combinations. But today I'm just talking about the only one laser machines for treating with post-acne erythema. So this is my disclosure. In Bangkok, Thailand, I work with a lot of laser company. Sometimes I got equipment loan and also research grant for doing research and study for them. So I would like to talk about post-acne scar first before going further. So we know that if you have acne and then it can, if you don't treat it well, you have the consequence of having acne scar. So we can grade the acne scar like grade 1 to grade 4. Starting with macular, the erythema, you can have hypo or hyperpigmentation mark, or if it's mild, further straight, you can see rolling or small papular scar. If the patient got severe inflammation and acne, it may follow by more significant rolling, shallow boxcar scar, or deep scar. But if the inflammation is very severe, you can end up with punch-out atrophic or sometimes even ice pick scar, which is very difficult to treat. So this is what we are talking about, the grade 1, just post-acne redness. Grade 2, start having irregularity on the skin's texture. Grade 3, you can see divot, rolling, punch-out scar. And this is the most severe form of acne scar. It's all this a consequence of having inflammatory acne. And during the healing process or inflammation, you can have the neovascular genesis, so new vessels getting on. So you will end up seeing the redness or erythema after the inflammation healed. And if you have active acne, it can follow by post-acne erythema. In the literature review and also in the practice, if you have some vascular lasers, this is all the lasers that has been published that can use to treat post-acne erythema. You can use vascular laser, pulse dye laser, 585 or 595. This is the most popular that you're using right now. You can also use low fluent Q-switch and DIAC lasers with using a 585 again. Or you can use fractional erbium glass laser 1550. But when we take a look at the absorption spectrum of all the lasers, you can see no wonder why pulse dye laser is popular, because there is the peak absorption spectrum of oxyhemoglobin is here. So this is why this laser is more popular than using fractional erbium glass laser, which more absorbed by water and less hemoglobin. So see, oxyhemoglobin will target in the blood vessel and can act as the chromophore of the pulse dye lasers. However, if you take a closer look and take close-up look at the absorption spectrum of oxyhemoglobin, you can see actually 585 and 595 is not at the peak of absorption spectrum. When we take a closer look, it's actually, at the highest peak, it's actually 577. Which means if you have lasers that deliver 577, it will get better absorption from oxyhemoglobin. So here. And there is one specific lasers that has been used by 577 nanometers already. We call it high power optically pumped semiconductor lasers. Okay, this is the penetration depth. You have to know that the longer the wavelength, the deeper the penetration is going. And 577 this is the depth of the penetration. So here it's actually at the level of vessels. So I think we can really utilize this for treated vascular lesions. So after I got the machine in my clinic, so we run the studies to make sure that if our assumption is correct, so to see it can be promising result, can deliver promising result to treat the post-acne erythema. And this is the study that we conducted, and I think we finished a few months ago. So we got the machine from the distributor in Thailand. It's just only for using the machine. I didn't really get any grant from them. We evaluate the efficacy and safety of using the machine to treat the patient with post-acne erythema. If you would like to see how the machines look, it's portable, very small. You can go to booth C35 at the exhibit area. So we are doing the split phase studies. Since we know that post-acne erythema is actually, it can go on, it can heal on its own. But we're doing split phase study. On one side, we treat it with laser, and on the other side, we left it as a control. And we recruit the patient who age more than 18 into the studies. The overall is 22 patients, and we do block randomized control with split phase. One side treated with laser, the other side was left as a control. And this is the machine that I mentioned about. So it's very easy. You're doing the scanner hand pieces, and we treat 80% coverage, 2 passes with these parameters. Since the absorption spectrum of 500 something lasers is also be able to absorb by melanin. So we need to be careful when treating the patient at darker skin tone. So we reduce the energy. And Thai people is more darker than European people. So it's very safe in my patients, and so it can be safe in yours as well. And we do 3 treatment at 1 month interval. And this is the baseline, 1 month to 1 month after the first session, 1 month after second session. And then we ask the patient to come back and do the follow-up after complete the treatment for 1 month. And we evaluate by using erythema index and melanin index, measuring by maximeter. And we also ask the patient about side effects occur after after getting the treatment. So this is the machine that we are using to measure erythema and also melanin. We just want to make sure that there is no complication of post-inflammatory hyperpigmentation after using these lasers. So here we measure on the lesions, and we also measure on the non-lesions as a control of the studies. And this is what the results are. So we have total of 22 patients. 1 was lost to follow-up. So we have the complete patient, only 21 patients. And the age is about 25 years old, mostly female, of course, they concern more. And we have mostly people with type 4 skin type, so which is a bit darker than me. So this is the result. When we measure the erythema index of the laser side, you can see there is significant reduction at 1 month after the first session, which is just only 1 treatment session. And it further reduction up till the last follow-up. And this is the lesion on the normal skin, so which we make as a control. So you can see on normal skin, there is no change at all. So when we conclude the cumulative reduction, so we see that there is at least 17% of reduction at the end of the studies. And this is on the control side. As I mentioned earlier, with the post-acne erythema, if you don't treat it, it will heal on its own, because it's very mild and it can be gone. So there is also statistically significant reduction when times go by. And there is no change in normal skin on the control side. So it's accumulated at about 11%. But when you compare lasers and control, you can see the higher degree of reduction of erythema on laser side when comparing to the control side. Okay, here, melanin index, there's no significant difference on both sides. So which means that it's not cause the hyperpigmentation after using lasers. Okay, when patients assess their improvement you can see after one treatment, they seems to have significant improvement on the side that was treated with lasers. Anyway, this is not the blind study for patients because patients always know that what side they got treated. But for dermatologists who is really blind to the treatment, so this is the blind dermatologist evaluation, there is no statistically significant difference. Pain score is tolerable. Most of the patients get transient erythema and resolve it in 30 minutes. When we ask the patients, at the end of the study, if they want to get other side treated too, 8 patients come back for treatment on the other side because they really see the difference between treated and non-treated side. And this is the examples of the patient. This is on the laser side. You can see she's completely clear after 2 sessions. And this is on the control side. You can still see the redness up until the last follow-up sessions. Okay, here. And we compare the clearing after 2 sessions from laser side. But this is still there, the control. So for discussion, so as I already mentioned earlier that this is the first clinical study on this type of wavelength of laser 577. These results show that post-acne erythema can also spontaneously improve over time, as we may know, without any treatment. But with this laser, we can see better outcome rather than no treatment session with 577 laser treatment. I think this is the first randomized controlled trial because when we look at retrospectively, all the lasers that has been published with this type of laser is not randomized controlled trial. It's just before and after treatment. So they didn't really know that additional benefit from getting the laser treatment done. It's just only 2 studies. One is our study and the other one is Dr. Tina Alster's study that we do split phase randomized controlled trial, and the conclusion is the same. On the laser side, get better improvement when comparing to control side. Evaluation for improvement, of course, the dermatologist cannot really detect the difference between laser side and control side, but the patient really sees the improvement. Maybe it's kind of information bias because the patient know what side that got treated. Anyway, post-acne erythema can improve over time, but with this kind of laser, we provide faster onset of post-acne erythema at minimal side effect when comparing to no treatment. However, so with this, even though it may provide only few additional benefit of non-treated, but it can demonstrate the improvement and efficacy on using this laser to treat on vascular lesion on others. And actually, I'm now doing the study with this machine on treating melasma, and the result is very good too. I think I can present in your meeting in Tuesday next year. And I would like again to promote the meeting that I conducted in Thailand. It's called AMWC in May 2017. Thank you.
Thank you for this excellent presentation and excellent results. Okay, and we have on the podium Patrick again.
No, I was going to introduce the next speaker
sure.
because I have to leave to meet Michael Keane, was saying at 3:15, and apologies, Anna, I'll be missing your lecture. Rungsima, wonderful. A lot of people, I suppose, are aware of post-inflammatory hyperpigmentation rather than post-inflammatory erythema, and it's come in, I suppose, more to dermatology in recent years. You can often tell the difference just even putting a glass slide on somebody's face and their erythema will disappear, whereas the hyperpigmentation won't. Often confused in skin types 1, 2 and 3. Now, back to Dr. Purnawati. Thankfully, this is the lecture I thought that Rungsima was going to give, and that's CO2.